Okay, so we are live. Thank you.
All right. Good evening, good afternoon, good morning, depending on what time and where you are watching us from. My name is Josana Dov, coming to you live all the way from Zambia. And I am the founder of She's Girl Foundation, and I am AYLF Zambia Vice President. And I will be your moderator for this evening. Now, it is safe to say that it's been a long time. It's been a minute since I hosted the AYLF Youth Dialogue, and I'm super excited. I'm super excited to see where this evening leads us. And I am excited that you could find time to be with us and to be able to join in on this powerful conversation. Because reality is, you could have been anywhere else, but you chose to be part of this meaningful and impactful conversation shaping the future of Africa. Now, tonight our topic is timely and important. We are going to be talking about building youth led support systems for a drug free Africa. Now, youth led support systems, these are programs, initiatives, designed and managed by the youth for the youth. A drug free Africa looks like an Africa that has close to zero illegal use of drugs, right? And so now, just a bit of context here. It is safe to mention that the African continent is navigating a delicate transformation, a delicate transition in demographics, economics, and the social aspects, with 60% of its population being under 25. It is safe to mention that Africa is both young, innovative, and creative. But the problem is, what if that population, majority of that population are using drugs, illegally using substances? What then becomes of the future of Africa? Reality is that if unless Africa has targeted interventions, the future is not looking all that bright. Hence the conversation tonight, which is building youth-led support systems for a drug-free Africa. Now, I remember I was having a conversation with my young brother about this topic, and I asked him to say, do you think it's possible for Africa to ever be drug free? And, he's very scientific, he's very factual, and he said, no, it's not possible. And he justified this by saying that the future, if we mention that the future of Africa is the young people and then majority of them are abusing drugs, then that would entail that the future is drug abuse, right? And that was factually correct according to him. But I told him to say we should not believe in a fixed future. And I quoted Newton's first law of motion, and I said unless an object, and if an object is at rest or in motion, if it's at rest or in constant motion, it cannot be disturbed unless there's an external force that acts upon it. That's when the motion will change, and that's when something will happen. And so I told him to say, you and I can be that external force that acts upon it. Hence our conversation for tonight. Now, to help us understand this amazing conversation is two amazing young people that are doing great, great things. Here with me is Mr. David, who is a global health advocate, and Madam Amantle, who is an emerging health leader. Now, I want us to get to know our panelists. I want us to get to know our amazing speakers for this evening before we even get into the discussion. And I would love to ask Madam Amantle, tell us a bit about yourself within a minute. Tell us a bit about yourself, what you do, what would you love us to know about you before we begin, and then we'll proceed to Mr. David. Madam Amantle.
Ooh, that is always my least favorite question that I get asked in these kind of things. Good evening, everyone. My name, simply, keeping it simple, is Amante Malkia Habalokwe, a final year nursing student at the University of Botswana within Botswana. And as for what I do, that is always a hard one to answer. Just in context, I sit in the executive of 19 international and local organizations, most notably being that I am the chairwoman of the African Youth Student Platform Medical Society. I am the faculty representative within the Faculty of Health Sciences within my university. I'm the president of our Student Nurses Association, and I'm also a mental health advocate, having presented my first research a few months a few weeks ago on burnout and other mental health issues amongst students within the university. So that's all I can just summarize in myself, is that I'm just someone who's passionate that the youth are the future. We're not even the future anymore. We are the present. That this whole we will do something has already elapsed. It is now our chance to do what we always wanted to do as kids. We are now the present leaders. It is time for us to implement those big ideas that we always were writing in our English conversations. And that is in summary who I am. Thank you.
Thank you so much. Indeed, the future has come. The young people are the future. Enough of saying when I grow up, I want to become this. You've already grown. It's time to make action. Thank you so much, Madam Amantle. And Mr. David, tell us a bit about yourself, what you do and what you'd love us to know about you. Thank you.
All right. Thank you very much. I'm Josiane. I hope I got the name correct. And thank you very much, Madam Amantle. Also, thank you for this beautiful initiative. I think it's a very good initiative. You know, when we think about young people and all of that. But my name is David Adebayo. I'm a Nigerian medical officer, um, and I'm also a global health advocate. I also work in health policy and systems for some companies in Nigeria. I sit on the board of some health tech companies as well in Nigeria, and I'm also passionate about young people. So I think that's a few things about me. That's yeah. So thank you.
Thank you. Thank you so much, Mr. David. Thank you so much, Madam Amantle. One thing that I can tell is that our speakers for today are passionate about young people. Amazing, amazing. And indeed, we no longer need to wait for the future. The future is now. The future has arrived. Thank you, Mr. David. And thank you, Madam Amantle. Now, before we begin, I would love us to get to understand the topic, which is building youth led support systems. What do we really mean by this? What should we know about this topic before we dive deep into, everything about it? What exactly does it mean, building youth led support systems? Mr. David, what do you think, in your opinion, what do you think that means? And then we can hear from Madam Amantle. Mr. David.
All right. So basically, youth-led support systems are systems, strategies, or well, and the likes that young people form that helps bring out outputs. For example, um, in Nigeria, for instance, about let's say 90% of people with mental health issues are not seen because we have less than 10% of psychiatrists in Nigeria. So the ratio of psychiatrists to the actual Nigerians, because Nigeria we are like 200 million people, and we have less than I think 1,000. So that's a very very large ratio of of doctors to patients. And why that's why we need more youth support systems because other countries, I know in Zimbabwe, for example, there is something called a friendship bench where people come, sit down, and talk. And initially, it was designed for like old people to talk to young people, but right now they've developed it into a mental health initiative where like just young people talk to each other who have also had the experience of substance abuse, mental health problems. So like they talk to each other, and in other countries as well. So I think that youth support systems is the way to go if we are going to have a very good output on mental health. Thank you.
Thank you so much. Mr. David says youth-led support systems. These are systems led by youth that help bring output. Thank you so much. Let's also hear from Madam Amantle. In your view, what do we mean by building youth-led support systems? Madam Amantle.
Thank you so much. In my view, building youth-led support systems, for me, it means it's about empowering young leaders and young people to create community accountability and resources so that young people don't feel the need to turn into drugs in the first place, or they can recover from drugs. Because when we're talking about young people, we're talking about people under 35. So we want young people, the under 35s, to be initiative makers and takers to deal with the drug crisis in Africa, because as you have stated, a majority of drug substance abuse users in Africa are young people. So we're basically empowering young leaders to make solutions for young people, by young people, led by those same young people. We're not waiting for government officials and for the adults. I was actually shouted at yesterday because they were asking us, why do we still call ourselves kids? But once again, youth and adults, I'm not waiting for adults to come with the solutions. We are now waiting, we're now taking the initiative. We're in the driver's seat so that we can solve these problems, because we understand them best. We understand what's driving our peers into going to drug use, things like unemployment, things like stress. We understand it because we are from this generation. Older people will tell you that, oh, we also had like these problems, but they didn't have the problems at the scale that we are having it. So it's the best people to help us is us. Thank you.
Amazing. The best people to help us is us, people under 35. Let us take the initiatives. We're no longer young people. We're no longer young kids. I mean, we are young people, but we're no longer young kids. And so we need to make solutions for the youth. Thank you so much, Madam Amantle and Mr. David, for helping us understand the topic. Now, we live in a world that teaches us to be strong, to be heroes, to endure pain, to endure to enjoy everything, right? And we often teach our boys to never falter, to be strong, to never be weak. And we teach our young girls to endure and never, ever, ever complain, and that nothing is too big for them to bear, right? And so this often creates a culture of silence, because if you're expected to be all this, then if you're struggling, and then you come out and say, I'm struggling, people will judge you. You'll be judged, you'll be isolated, you'll be looked at as the odd one out, right? And so this often creates a culture of silence. Madam Amantle, I would love to find out from you, in your view, how does silence within our communities, our families, our schools, how does silence enable substance abuse? How does it enable substance abuse? And is there a way that we can intentionally come in and create an environment that is safe for young people to come out and just express their struggles? Is there a way that we can create such an environment? So does silence play a role in the use of substances? And how can we create a better environment for our young people to come out and express themselves? Madam Amantle.
So I think the first thing we need to understand about silence in Africa is that it's not just a noun, it's actually a doing thing. Silence in Africa is not like the absence of noise. We take an active decision not to talk about these things because we want to preserve things like family honor, religious beliefs, and respect for adults. So while these values are important, they become a liability when dealing with substance abuse, as we can see. So what can enable these things? Things like family and community stigma. When your child has mental health issues and drug abuse, I want to say the right word. When your child is addicted to drugs, your first response isn't in how do I help my child? Your first response is, what is auntie over there going to say? What is that person going to say? And that's a problem, because now you're going to be thinking about how to keep this on the down low. You don't want to take them to counseling, because what if one day you leave the counselor's office and then they see you? What if one day people are like, is it true that your child is addicted to crack? Things like that. And even worse, sometimes we attribute these substance abuse things to religion. I'm also a religious person, but I can't look at a person struggling with drug abuse and say they're possessed by demons. But unfortunately, that is a common thing in Africa. We will take these youth who are addicted to pastors, to traditional doctors, to the people at the mosque. And then that's not going to help them, because the person they're not receiving the medical and psychological help that they need. They're just being told that, oh, your problem that you think is your problem isn't your problem. Your problem is demons, which we can very much see it is not the demons. And then another thing that we can look at is in schools. The African schooling system is not very supportive. It's very punishment ready. The second the child fails in school, they're getting beaten. The second the child is late to school, they get beaten. They're not wearing the right uniform, they're beaten. So when they use drugs, they're beaten. We never sit down as people in schools and wonder, what is making this child do this? This child is late every single day. Are they late every single day because they just don't care? Or is it that every morning they need to take care of their younger siblings first before they can focus on themselves? Is this child using drugs just because they saw Tommy using drugs? Or are they using drugs because they are generally addicted to drugs or that they are trying to cope with something? Another thing about in schools is students, especially teenagers, they're going through a period of time whereby peer bonds are the most important things. You want to belong. So in this belonging, not only are they going to fall under peer pressure, but even those who don't do drugs, they fear being called the snitch. You all know the phrase, snitches get stitches. Nobody wants to be the one who reports that, oh, Canada boys at the back who are smoking. So last year, I think it was last year, yes, we had like a community study in a small village called Tawung, in which we are asking the students, do you know anybody who does drugs? They all told us no. But when we asked the teachers, they say, yes, we do know that the students who do drugs. You can tell that the students don't want to talk because even on an anonymous survey, that whole stitches thing is a mental thing now within our students in Africa. And then what can we do now? We know the problem now. We know what makes the silence. What can we do to break down the silence? And like I mentioned, the silence is an African thing. Therefore, for us to solve this African thing, we need to dismantle it. Our ex-president once initiated a campaign called Mindset Change. And that's something that we need to do. We need to have a cultural shift. Awareness campaigns are not enough. As long as you are not changing your mindset, nothing will change. So the first thing we need to do is we need to normalize these uncomfortable conversations early. And this is something that many African parents don't want to do. When they start talking about drugs, all they say is don't do drugs. And then you stop there. We don't help the child identify what are drugs, the types of drugs, because we've had stories of students in university accidentally consuming space cakes because they don't know what space cakes are, because their whole life drugs have always been kept as a taboo. You only know about drugs that stay away from them, but you're not told what are drugs specifically and why you should stay away from them. You just know that you should stay away from them because mommy and daddy say so, which is not powerful enough. So an example I'd like to give about normalizing these uncomfortable conversations is a project in Zimbabwe called the Pillars and Plants Project. So what they did was they were training people who they called gatekeepers, which are pastors, community leaders, and parents, so that they can help, so that they can be sensitized about drug abuse, and so that they can learn how to communicate with the students and with the children. Sorry, and it doesn't just end at those talks with our children. They even hold events, art expos, music, dance, things that resonate with the youth, because I resonate more to things that I enjoy than having to sit down through a lengthy lecture where someone tells me for 2 hours what is drugs, what is drug abuse, what are the consequences, etc. And number two, we need to move away from a punishment system to a support-based system. We need to understand the root cause of drug abuse for us to address it. We can't keep beating it. If beating did help, we would have like the lowest drug abuse rates like in the world, because African parents are very quick with the beating. That one we know. We always take pride in it that, oh, when we see a rowdy child, we're like, my parent would never. But we can see that beating is not working. So we need to have the support-based support in schools. In schools, let's have on-site counselors. I'm not sure how many schools have on-site counselors even, because even at my middle school and in junior school, that's when most kids get initiated into drug abuse. We only had one counselor for that big school. So how was he supposed to see every child who was having a problem? We need these support guys. We need to have these groups, these anti-drug groups in school. Another thing that I loved about the project that we did in the Taung village is that we had like a drug awareness day. And at the end, the police officer said he wants to start a project on mini police in school, being students who will police other students with drug abuse. So things like that. And which leads to my last solution, training peer leaders. Youth will talk to youth. You only listen mostly if your age mate comes to tell you, oh, this is not okay. Because when adults tell you, you're in that rebellious stage where they're like, they don't know anything. But if a youth comes to you, especially a youth has gone through this and tells you, like, I was addicted to drugs. This is what it did to me. Don't do this. They're most likely to listen. Thank you.
Thank you so much, Madam Amantle, and you've really raised important points, such as, the fact that silence is something that people choose to do. People choose to remain silent about these things, and the first response that they give is, what will somebody think about me? What will they say? And I love the thing that you've mentioned about, how people who are struggling with addiction are often referred to as demon possessed, which leads me to the question that I will ask Mr. David. I mean, Madam Amantle has mentioned to say, people who are struggling are often seen or categorized as possessed or having a problem, and so we see young people or people who are struggling with substance abuse often isolated than supported, right? And so, do you think youth initiatives or initiatives in general are inclusive? Do you think they're inclusive of these young people that are actually struggling with these with substance abuse and drug abuse? Do you think youth initiatives are inclusive? To what extent are these are these initiatives inclusive? To what extent are they inclusive? And is it possible that we might be unintentionally excluding the people that we ought to be helping, Mr. David?
All right. Thank you very much. I've really had an insightful session so far. Thank you, Madam Amantle. You really did well on the previous points. And youth support initiatives. To be honest, when we have people who are struggling with things like this, the way our support system is right now is that we only cater for people who come out. So, for example, I have a rehab. I'm not going to go into the villages to look for people struggling. I'm only going to find the people that come to me and ask for help. And that is what is currently happening. We've not developed a system where everybody is catered for currently. We've not developed a system like that. But what we can do, and what we can do is that we initiate peer support groups, like Madam Amantle has said. I think that's one of the that's one of the ways to go, because it showed that, I think a research showed, I think it was in Zimbabwe, I think 65% of people who, like, they did a trial and they saw that people who had who had like support groups and people who had gone through what they had gone through, they got better faster than people who didn't have that. And the research also showed some rats. So they did this research, and they showed a group of rats. So some rats were fed cocaine, and some rats were fed cocaine, and some other rats were also fed cocaine, but they put them by themselves alone, and the other rat was put among community, and it showed that after like 30 days, the rats were going to their communities than the cocaine. So it means that your community, when people have the same issues as you, when you see people who are going through the same things as you are easily able to come out of that than being alone. So that's one of the things that isolation does, is because it accelerates the behavior. So, for example, one of the pathways in the brain thrives in loneliness. So when people start drugs, it triggers a pathway in the brain. And when it triggers that pathway, it triggers an extensive reward system, which means that everything you think about in time is to use drugs. So you always want to be alone. That's all you think about. That's all you breathe. And that's when when they come with withdrawal symptoms, you see that they have a lot of systemic manifestations. You see that their body is shaking, they're sweating, they're doing everything, because they have to take those drugs at that time. Because there's a pathway in the brain that has been rewired. So isolation would always accelerate the behavior. Isolation will always make the behavior worse. Isolation will always stall treatment, because many people, and another thing that happens in the brain is that the identity is rewired. So you see people who struggle with these things tend to accept that that's who they are. They say things that they tend to attempt. So like the identity is rewired. So one of the things that we need to do, number one, I think going forward, to have an Africa that is rid of substance abuse, number one, we have to remove the stigma on drug abuse. I love what Madam Amante said about demon possession, and I'm from Nigeria. You can see it's very times 10, because anybody who smokes is already like failed has failed in life. So you see a lot of things like this. People who hide their children because they smoke, but it's an actual problem that needs to be talked about. We need to actually speak about this thing. Even people are afraid, not afraid, ashamed of taking their children to rehab. So you see people who will take their children as far as like far away from the actual main state because they don't want anybody to know their children going through these things. And I don't blame them, but we have to remove that stigma of drug abuse, because when we remove that stigma, people are able to own up. There are different levels of drug abuse. Some people are addicted to little things like paracetamol. Some people are addicted to little things like it's just a lot of funny things. A lot of funny things. It's a rewiring in the brain. It's something that has to do with the brain. And I noticed that because of our economic situation in Nigeria, a lot of us don't know how to manage our stress levels. So when that happens, our energy level is off. People go into these things more often because stress level management is off, energy level management is off. So you have an environment that is constantly giving you stressors all the time. For example, in Nigeria, you guys are Africans. You can see what's happening in Africa. Fuel prices are up. People want to stay in their houses and just isolate and do other things. For us to actually get to some of these things, we need to actually develop peer groups, communities. The government has to mandate peer groups and communities where people can just come up to the clinic or to their groups and say, okay, this is what I'm going through, this is what I have, and they talk without judgment. Another thing is Africa as well. We judge people a lot. Oh, you're a bad boy, you're this, you're that, you're that. So even makes people even want to isolate them more. So we need to first of all one develop a strong community where people can actually talk about their problems and like speak about their problems and seek help. And number two, we also there was a research done in Australia. It's called Headspace. I think I was researching about Headspace. So Headspace is it's like a clinic sort of for young people 18 to 35. So these people just come into the clinic, talk about their problems, see people who are also going through their issues, and they get better. Just like AA, Anonymous. These are the ways that people we can support these people. So our current systems enabling or fighting the actual problem, no, our current systems are not. We need to go to where people actually need it. We need to go to the slums. We need to go to the villages. We need to go to schools. I'm surprised that, like, basic school, high school, a lot of this, people have started using drugs, but you would never know unless, like, you actually go there, talk to their colleagues, and ask them, does this person use drugs and stuff? That's when they start to tell you that they're using drugs. I work in the clinic. I see different kinds of combinations, and I'm even surprised that this ever existed. Like, people come, what did you use? They tell you, oh, they use codeine, they use this. That's like, where did you get it from? They buy it from over the counter, but you would not know because you think that this person is a very young person. They can't use these things. But that's where it's really, really happening. We need to go into the schools, the communities, the slums, everywhere. And also, we need government policies to remove the stigma against drug abuse. People can get healed from drug abuse. People can have normal lives from drug abuse. So far, you are willing to put in the work and get better. Yeah.
All right, thank you so much, Mr. David. That was indeed comprehensive. And I love how you talked about the fact that isolation accelerates the problem, and that the solution is building support systems for people that are struggling. I love how you also mentioned that we need to remove the stigma surrounding drug abuse, surrounding substance abuse in Africa, the judgmental looks that people get when they're smoking. It's very, very bad. And then the parents know that, I've judged someone's child before. So if my child is going through this, they'll be judged. So let me do this, let me do that. There's really a lot of stigma, a lot of, judgment regarding that. And so if as Africa we need to move forward, we need to really, really, really get rid of the stigma that is surrounding mental health, surrounding drug abuse, surrounding substance abuse. And when we remove the stigma, I love how you mentioned that people are able to come out and they're able to seek help and they're able to find the help that they need. Thank you so much. Still with you, Mr. David. And, Madam Amantle talked about how awareness is not really the solution unless we change our mindset, right? And so I've noticed that most of the time, people, organizations that are into mental health, into substance abuse, drug abuse, they're always talking about we're creating awareness, we're creating awareness, we're creating awareness. But what does meaningful change really look like? I mean, we often speak about awareness, but yet we still see that there's a problem. We still see that the problem still persists, right? So what does meaningful change actually look like on the ground, beyond campaigns, beyond conversations? How can how can we make this conversation into tangible change, Mr. David?
Okay, thank you very much. So one thing we need to know about awareness is that awareness just moves empathy, but doesn't really change outcomes, to be honest. Yeah, a lot of people, we go on media and say things, but if we don't have the structure to be able to change the outcomes, then we're not going anywhere. People people need to be, first of all, you need to start from 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 schools. I don't know about your countries, but in Nigeria we have a pandemic of lack of psychiatrists in the country. We don't have up to, I think we have less than 5,000 for a population of over 200 million people. So we are creating awareness, yes, but people are not being treated. There are fewer rehabilitation spots like ever. There are very terrible economic issues. So these are the things that are siphoning our our changes and results. Because if these structures are not put in place, we can't go anywhere. So, for instance, there was a research that just came out from the UK NHS that 90% of the psychiatrists in Nigeria are now practicing in the UK. So when we do that, we leave the chances to quacks, YouTube, whatever, to take over, and then people are not being taken care of. So for us to have meaningful care, we have to fix our economic problems. To be honest, I think for me, that's how I see it. I think that we have to fix our economic problems, and doing that would help to see more outcome. Because no matter how you want, like, somebody who struggles with substance abuse needs to be treated clinically first of all. Yeah. After then undergo different therapies, psychotherapy, and all of those things. But clinical treatment needs to be there because you've rewired the brain. You can, if you look at a brain structure between a normal person, not a normal person, but someone who struggles and someone who doesn't, there are very big differences in the brain. So they need clinical. So if we don't have that, we're not going anywhere. And number two, we need to start having discussions. We need to train teachers in schools. And that's a problem. This is also in line with also sex education as well. people people are not taught. You see, your teacher will just come and just say, "Oh, you're a bad child, you're this, you're that, you're that." So nobody wants to come and like own up to something or talk about how they are going through. So we need to actually train people. We need to have more. We need to have more. We need to have more teachers, or we need to have more employees that would sit on the ground and actually go through this place. All I'm trying to say is outcomes are almost back to a governmental policy. And if we can have our government supporting this, it's going to change Africa in a very, very large scale. I don't know if you understand, but that's what I think.
Thank you so much. And we indeed, we do understand. Thank you so much for that. I love how you mentioned that awareness just moves empathy. It really changes nothing, and if we need actual change, we need to implement systems, structures, and we need backing by policymakers and government. Thank you so much. Madam Amante, I would love to find out from you. Mental health has become a topic that everybody talks about. It's on the news, it's on social media. Everybody's, creating awareness about mental health. It's suddenly everybody knows about anxiety, everybody knows about depression. And you hear people tell you that I'm healing from trauma, I'm healing from this. Like people know. A lot of young people in this generation now know about, mental health because the previous generation, they didn't have words for things like depression, anxiety, burnout, but this generation, we have people that talk about mental health. We're having this conversation now with the coming in of technology. Mental health is being talked about, right? But then it raises a question as to, is this generation really understanding mental health? Have we really understood mental health, and are we really healing? Are we really healing, or it's just become a trend? We just want to go viral. So we're having this conversation now because we want to go viral, because we want to jump on the train, we want to jump on the trend. Have we really understood mental health as a generation, or is it a trend really, Madam Amantle?
Thank you so much. And that is a profound question. There's a difference between being aware of something and understanding it. And that is the question that we're having about the African youth, because we can see the awareness. Everybody knows the words like OCD, depression, etc. But we're still seeing that lived reality of stigma and the structural deficits that we're seeing in our African societies. So in regards to the awareness versus understanding versus deep understanding, we actually have a study from Rwanda in which it was found that 1 in 7 mental African adolescents live with mental health problem conditions, which sometimes they don't know and sometimes go untreated. And I kind of and I do believe that because right now I'm under my psych clinical rotation, and last week our lecturer said something very interesting. She said that every semester there's always a student that stays behind in the ward, and we asked her, what do you mean? And then she said 1 in 4 people here don't know that they have a mental illness. And that's partially because we've done what I call, we minimize these words. Like we use words like depression, we use words like trauma, we use words like OCD when they're actually not supposed to be used. Someone will be having, like, there'll be a clean freak and they'll call it OCD. It's not OCD. You just like cleanness. You'll be sad because your friend hurt you, then you say you're depressed. No, depression is prolonged sadness over 2 weeks. We have this thing of minimizing those mental health words. So we can't really differentiate between clinical depression and the economic anxiety of unemployment, or just the things happening in our lives, right? So do we really have true understanding as Africans? The problem with Africa is maybe we do have true understanding, right? But it's not going to be caused by the same things that affect other young people all over the world, right? We have a lot of eco anxiety, we have a lot of social economic survival. We are fighting for our lives as young people. So even if you are aware that maybe you have a mental health crisis, how does you being aware that you have depression put food on the table? How does you being aware that this is happening help you with the fact that you have no job? So we're seeing things where people, I would like to give an example with Nigerians. I'm so sorry, Mr. David, but there's an interesting thing that Nigerians do for me in which they're such hustlers. Like everything that they see, they will turn it into a hustle. Like there's no time for self-care with them. You'll be painting because you love painting, and they'll find a way to turn that into a hustle. There's no time for rest. And that's the thing that's affecting, that's what's seeing a trend in Africa, whereby when a student tells you that they're struggling because they're telling you that they're struggling because there's no money. You tell them, why don't you have 2 side hustles? How are they supposed to handle side hustles with academics when academics is also already so bad? Like, so we're having this thing So how do we solve this awareness issue? So number one, to kind of address that gap of people not really understanding terminology and just throwing it around, we need to integrate mental health into primary care, right? And also into primary education. Let's start from primary. Let's teach the kids what depression is, what anxiety is, what OCD is, because there's this other African belief that kids can't get depressed. The second a child tells you that they're depressed, you ask them, why are you depressed when you're not the one paying bills? But kids can be depressed by things like seeing violence in the communities, by the fact that their parents are abusive. We never consider these things. So I feel like children are supposed to exist. Yeah, they are supposed to exist in a bubble of happiness, but they don't, unfortunately, in the African context. There's so many social ills happening in our families. So we need to integrate these things also so that these kids can be able to identify their problems from a young age, right? So that doesn't end up being trendy in which they're like, oh, I have OCD. But now when a person actually has OCD, we now have the medications to treat them, right? And then we also might be able to leverage our technology. So in Africa, an interesting trend is almost everybody owns a mobile phone. In fact, in most countries, in some countries, for example, Botswana has more mobile phones than it does people. Because on average here, people have two phones. I myself have two phones. So we could use technology as a way where we can have skills training for people and peer support, right? Rather than just having awareness memes, because awareness memes are just kind of, you only see that surface level of depression. Many people think depression is being sad, but then they start becoming uncomfortable when a depressed person tells them that, oh, I haven't taken a shower, I haven't brushed my teeth in 5 weeks, because we're used to the big sad depression and we're not in that dysfunctional depression, because that's what mental health illnesses are. The dysfunctional, they're showing that you can't function like a normal person. And we want to show you that it's fine. It just means that your body is crying out for help, right? And also with our cell phones and stuff, we have a mobile which had a number that you can call for free so that they can give you online counseling. You can call them anytime. You don't need to tell them your name. You just tell that number, you just dial that number, call, and vent, because that's what most people need right now. They just sometimes just need to vent because they don't feel safe venting to their family. They can't vent to their pastor who will just tell them to fast and pray more. They can't vent to their peers who will probably ridicule them, saying, whether you're complaining that you're doing geo, I'm doing medicine and I can't breathe. Like, we're making it a struggle competition. And yeah, that's what we mostly need to work on. Also integrating it into families, right? That whole cultural shifting, that not only do the teachers need to be aware, as Dr. David has said, teachers are not aware of these things. They also only know surface level things. I've seen a growth of autistic kids in Botswana, and I'm wondering if the teachers are able to identify them. So the same thing should be taught not only to the teachers, not only to the families, but also to the healthcare providers. This is actually something that we don't think about mostly. We always think about healthcare providers as people who are so educated, but some of them also don't know how to help people with drug abuse, addiction, and also mental health issues, because we mostly focus on the diabetes, the flus, the etc. So we need to be able to teach these healthcare providers like a first aid kit, a first aid step by step of how to help a patient who comes to you telling them, I want to end my life. We are seeing this struggle also in Botswana, in which we don't have enough psychiatrists, we don't have enough psychiatric nurses. Therefore, we need let me just say the non-specialized health professionals to also be educated in these topics so that they don't say, I have to wait for Dr. Ochembe who's only going to come in 2 weeks, right? They know, okay, I can refer them to unfortunately, we only have like 2 big mental health facilities, but yeah, I can refer them to Sabrana in Botswana so they can go see the psychiatrist. The psychiatrist says they need to come here. Just things like that. So like David has said, we also need to change the system. These things are happening because we don't have psychiatrists, we don't have psychiatric nurses. So the government, unfortunately, also needs to help. We need to tell the government as the youth that, hey, can you stop with the whole fleets and stuff? We need to improve our healthcare system. But yeah, that is my submission. Thank you.
Thank you so much. That was one comprehensive response. And indeed, that is one way that youth-led support structures can move beyond symbolism, performance, and actually be meaningful and have meaningful engagements. Mr. David, still the same question. Do you think that this generation is treating mental health as a trend, or have we really understood what it is? Within a few minutes, because time is not on our side, Mr. David.
All right. Good question. So I think this generation treating mental health issues as a trend. Yes, I think so, because now we have words like OCD, um, you know, just throwing these words around, and I think that it's. I think that because awareness is getting more and more, so people kind of have an idea of what it is, but people do not know what it really means. So I think part of our job will be to accurately dispense proper information about these things, and yeah, while also creating awareness about it. So this generation is treating it like a trend. I fully agree. So
Thank you so much indeed. And that's really something to note about this generation, is that a lot of people will tell you that I'm healing, I'm doing this, I'm doing this for my mental health. I need peace of mind. Someone will break up with their girlfriend and say, I'm doing this to heal, or I'm doing this because of my mental health. And so, yeah, mental health is a word that people are really throwing around. But it's really important to just make sure that we've also healed as a generation. Thank you so much, Madam Amantle and Mr. David. And before we conclude, I would love to find out from Mr. David and from Madam Amantle, what do you think are the most pressing barriers confronting youth initiatives today? What are these challenges that youth initiatives or organizations that are dealing with substance abuse, drug abuse, what are the barriers that they're confronting? What are they facing? And how can we position young people? How can young people position themselves, not just as participants, but as credible and effective drivers of sustainable change? So what are the barriers that we're facing while we are handling drug abuse, substance abuse? And also, how can we as young people stop being, passengers in our own lives and actually just take the driver's seat and drive sustainable change? I'll start with Mr. David and end with Madam Amantle. Mr. David.
okay. So comprehensive question. So what are the barriers that we are having? Number one, funding. A lot of mental health organizations rely on grants. So grants come in 12 to 24 months. After that, they need another grant. So that's also causing a big problem because we don't there's lack of funding. Number two, I think that lack of manpower. We have a big issue of manpower in Africa, so we don't have a lot of manpower. Burnout by staff and all of those things. I think poor education on the side of teachers. So how can we be the drivers? Because I know that time has gone. How can we personally be drivers? So personally, after this session that I've had, I want to go and read about mental health more because I realized that I've not read about mental health in a while. So we need to young people need to get accurate information about what mental health is, what the terms are, the correct application of the terms. Also, just like the way we teach CPR, just basic first aid and stuff. I think that people also need to be taught mental health protocols. So when someone is having a crisis or a breakdown, what do you do about it? How can this be done? How can that be done? So I think that it should be included in schools as well. Young people should be taught early about the proper terms, terminologies, proper curriculum about mental health problems. And yeah, I also think that if you have the money to set up a facility, a rehabilitation facility, or a clinic or something, and you can also set that up as well. And people also should go to school to learn about these things more. So I think that is how we can actually be the drivers and ultimately try to avoid substance abuse too. So yeah.
Thank you so much indeed. And words from you as well, Madam Amantle, on the question, how can young people be participants and build, effective, sustainable change? How can we be participants and just bring about credible and effective, sustainable change, Madam Amantle, in a few minutes?
So Dr. David covered the most important part, being the skills and education training. You can't really teach a community when you yourself are ill-educated about a topic. So the first thing we need to focus on is bringing this education, this resources to the youth in our communities, right? And then the second thing we need to work on is maybe integration of young people into policy tables. The problem with youth nowadays is that we're the voices of the future, which is a problem because we're voices, not decision makers. We are heard, but our things are not implemented. We are celebrated, but not funded. We are visible, but not institutionalized. So something that we need to make sure is that young people have a seat at the table, not the advisory table, at the actual policy table. We need to have like quorums that, for this thing to be passed, we need this amount of people to be under 35. You need these people to be under the youth thing so that young people are consulted throughout the whole process of these policies to help substance and drug abuse, right? We're not only told at the end, like, here's a project, what do you think? No, from the get-go of the project beginning, we need to be there as young people. And then because of the financial constraints that he did talk about as a barrier, we need to start being creative. We need to start thinking about low cost, high impact tools that we can use as advocacy. We don't need to be having these big events. Just go to schools, have art competitions, have this competitions such as the Pillars and Plants project in Zimbabwe. Have social media campaigns. Contact these famous people that you know that young people listen to and ask them to talk about that topic, because young people are very impressionable. And if, for example, us V is talking about drug abuse, some young people are willing to listen. It doesn't have to be something expensive. It doesn't have to be something costly. And like Dr. David said, sometimes we need to really dig into our own pockets. So we should try doing something called social entrepreneurship, in which we have this NGO, you have this social organization, but at the same time, it is generating income for you so that you can run other projects. We can see how the world is. We can see that how US politics is right now. We can't be waiting for these grants. We can't be waiting for this US aid. The time for us is no longer time to be waiting for someone to save us. It's time for us to be our own saviors. Thank you.
Thank you so much. And I love how you've talked about, the challenges, things to do with finances. You've talked about how, we need to get accurate information as young people if we are to, be drivers of actual change. We need to get accurate information. We need to think about low impact advocacy, and we need not low impact, low we need to think about advocacy that is high impact, but that we can use using low income, or it's not taking up a lot of expenses, so to say. And we need young people to sit in the actual decision-making tables. I love that. Thank you so much. We have a question from Mr. James. Mr. James, if you can come through and just ask your question within a few seconds, sorry, and then we can also conclude.
Thank you so very much for the wonderful job, and to our astute speakers. It's been a very wonderful day. For the purposes of time, I've really learned a lot in this section, and the question I want to ask is in line with the Africa We Want Agenda 2063. Youth play a pivotal role, most especially Aspiration 6 of the agenda. What it talks about, it has to do with youth involvement, especially with women, and youth empowerment. And what is most crucial is the safety and security when it comes to the health aspect. Initially, it didn't make any clear impact or deadline or pathway as to how that is done. But there's been other um, 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 input from the Pan-African Parliament resolution in 2024 that has further mandated, the involvement in youth in addressing drug abuse in Africa. And in most, especially when you go to the advanced world, before you even can buy the smallest medicine in the shop or in the drugstore, you have to show proof of an ID and that you're of age to purchase that drug. And I see that missing out in the African context. Maybe I don't know your various countries where you're coming from. Do you think they lose the strict, not we not strictly adhering to those principles is as a result of we experiencing this drug abuse and what have you? And if you're having the same thing in your countries, what do you propose that the system should recognize and in enforcing such, rules in preventing it right from the beginning before they even occur? Thank you.
Thank you so much for that question. And we can have both our speakers attempt to respond to that. We'll start with Mr. David, and then we can proceed to Madam Amantli.
Okay. Thank you very much for that question. So strict implementation of age limits for prescriptions and all. I think that already is in place in most African countries. I'm not sure, but for example, weed is not sold in the pharmacy. No, neither heroin in the pharmacy. I think that these things are not even gotten from like over the counter. I think most of these things are gotten from illicit vendors or illegal vendors. But I agree that strict implementation of would um, age limits and would increase a lot of compliance when it comes to like prescription. And also, how would we implement this? Would have to, wherever we are, take it to the highest governmental policies there and you know, try to like pass it as a rule. Because I already think it's been done. I'm not sure, but I think it's been done. I wouldn't sell like medications to a 10-year-old unless he has a prescription already. So I think it's already been implemented in, well, maybe for Nigeria, but I'm not sure of other places. Yeah.
Thank you so much, Mr. David. And Madam Amantli, short, precise, and then we can conclude.
That is such a very interesting, hardish question, but I'm going to say that I'll always say what I like saying. Prevention is better than cure. We can talk about what they have to do in order to curb this, but why don't we just talk about adopting a human-centered approach in which we're focusing on prevention and rehabilitation over just policing of drugs in Africa. Like, let us first work on what is driving these young people to doing drugs and cutting that off. And then we can also focus on with the young people who are on drugs now, how do we help them? And then work on that. This whole trying to police thing, we can tell that it's not working. For me, it's like an adult version of the whole our parents beating us to make us behave. We can see it's not working. So I would say let us just adopt a human-centered approach, and that could solve so many of Africa's problems. Thank you.
Thank you so much, Madam Amantli, for that short and precise response. Indeed, it has been an amazing discussion, but all good things must come to an end. And at this moment, indeed, it is time for us to end our meeting and our discussion. It has been amazing. And I would love to hear just final words, final remarks from our speakers before we call it an evening. Madam Amantli, final words from you, and then we can hear from Dr. David as well, and then we call it an evening. Thank you. Within a few minutes.
I think all I can say is that the time for change is now. Like I said at the beginning, there is no longer when I grow up, I wanna. There is no time for I want to anymore. It's time for you to wake up and finally take that decision. I know that it seems like it's a very hard thing to be standing against the government. And I've noticed in Africa, we see the government as this dainty, this god that we cannot fight. But governments are very easy to dismantle. Something that's giving me really hope, a lot of hope in Botswana right now, is we're no longer scared of protesting. In the last 2 weeks, we've had 2 protests. One protest over the increasement of transport fees, the second protest over a child who was raped and then committed suicide, but no investigation was done. I can tell you right now that those two things have now been resolved, all just because we decided to stand up together and make some noise. As young people, if we can make some noise at a party, we can definitely make some noise about issues that concern us. So what I'm saying is, text that friend of yours, text your classmate, tell them, my sister, my brother, it is time to stand up, because the Africa we want is the Africa that we have to create. Thank you.
Amazing, amazing, amazing. The Africa we want is the Africa that we have to create. We have to create. Thank you so much. That was amazing. Thank you so much, Madam Amantle, for coming through. And let us hear from Mr. David as well. Your final remarks, final words for us, the viewers, for everybody who's listening in, Mr. David.
All right. So this has been a very, very insightful session. I've learned a lot, and I believe that you have too. So, in summary, what we have basically talked about is that we have to move from awareness to actually doing something. So, practically, how do I do that? Practically, just getting more information about um, mental health issues, trying to help people who are going through these things, referring them to the appropriate facilities to take care of them, and just spreading the word about drug abuse and substance abuse in Africa. So it's been a very insightful session. Thank you very much to the organizers of this. I really learned a lot, and I hope to see you guys one more time.
Thank you so much, and we hope to see you again one more time as well. Thank you so much, Mr. David. Thank you so much, Madam Amantle. It has been really an amazing discussion. It has been an amazing, amazing discussion, and our speakers made it tremendous. And we would love to also acknowledge our viewers, our YouTube viewers, those who are watching us right now, those who will be watching us, and those who will watch us tomorrow, the day before, the day after, the day after, and the day after. We love you, and we're doing this for you, our young people. Now, it is safe to mention that the role of the youth in shaping the Africa we want cannot go unmentioned, cannot go overstated or understated. You know, the future we want can only be created by us. I love that statement. And as Africa deals with unprecedented challenges of climate change, economic challenges, drug abuse, it is evident that the solutions to these challenges lie in the hand of its young people. And I would love to hear from you. As AYLF, we would love to hear from you in the comment section, and reach out to us through our social media platforms. Reach out to our speakers. Follow Madam Amantle, follow Mr. David, follow AYLF Zambia, follow AYLF Africa, follow me as well. I need you to follow me as well. And let us create change, because change starts with us. Thank you so much for joining us on this amazing discussion. Let us meet next time